Coping with cancer is one of life's greatest challenges, but every day, someone in our community with cancer faces the added stress of exhausting all funds, hitting the limits of insurance coverage, or just not being able to work any longer. The choices are tough: to pay rent or to pay for treatment, to buy prescriptions or groceries, being too weak to move without a walker or a wheelchair, but unable to afford one.
After the cancer diagnosis, patients have to completely adjust their priorities. They're faced with a lot of difficult issues. One of the biggest impacts cancer has in their lives is the loss of their financial independence.
A group of special social workers from University Medical Center were aware of the many challenges facing a patient diagnosed with cancer and decided to create Sobreviviendo El Cancer, Surviving Cancer.
My stomach started to grow. I'm heavy. I'm already heavy, so I thought it was gaining weight. So then I started to watch what I was eating, but it still started to grow. So at that point I said, no, something's wrong. So I did go to UMC, and they did tell me I had a tumor the size of a basketball. Yes, it had grown enormously. So that was when I was diagnosed with cancer. Surprised, because I thought that cancer didn't run in my family. But this is my third reoccurrence of cancer.
Ms. Hernandez has insurance. However, her insurance doesn't cover certain copays. When you're talking about $90 per treatment that she has to cover, aside from medication that she has to get, lab work, procedures, doctor's visits. So Sobreviviendo El Cancer program has been able to help Ms. Hernandez with a portion of the copays for her treatment.
Through Sobreviviendo, University Medical Center of El Paso provides cancer treatment and additional support for each individual on his or her journey toward becoming a cancer survivor.
Some patients have mentioned to us that because they no longer have the money to cover the copays, they're not coming back. So our program tries to help those patients so that they can stay on the course of treatment and make sure that they finish the cycles that the doctors recommended.
Well, first it was just a pain in the back. It started I thought it was just like a normal pain, and then it just got worse. My aunt decided to take me to UMC. She took me there. I got to emergency. From there they did some studies. Then after the results came, they told me that it wasn't kidney problems, that it was cancer. There's not much you can say about, when they tell you that it was testicular cancer and you needed surgery to remove it. So for a man, it's a little difficult. I just don't think it's gonna happen to you at that age, but it does happen.
Because of the non-funding status, Sobreviviendo El Cancer program helped Mr. Otmar in making sure that he get his chemotherapy medication. I would say that Sobreviviendo El Cancer was essential in getting for Mr. Otmar to get his treatment. He completed treatment. I'm glad to say that he was very happy over that. He came in and said thank you to all the staff here at the Infusion Center.
Cancer does not discriminate by income or gender or age.
Porque tenía accesos de bolitas en el pecho. Pues solo pensé que era un quiste, tardé, hice desidia, pero ya cuando me hicieron la biopsia y una operación, pues supieron que era cáncer. Tengo breast cancer. Aquí en la Universidad Medical Center has muy buen trato de todos.
So we develop a really close relationship with most of our patients.
To be able to provide the best service, the best compassion, and many times, love and compassion for the patients.
And Ms. Saucedo was working as a waitress at a local restaurant. But due to her medical condition, she has not been able to return to work. So right now, hopefully, as long as we have funding, Sobreviviendo El Cancer will continue to help her out.
La Fundación de la Universidad Medical Center. Ellos me han apoyado mucho y me han ayudado con muchas cosas como Por ejemplo, a veces no tengo cómo pagar mis quimioterapias. Ellos me pagan o mi medicina o cuando he estado en el hospital. Oh, si no existiera, no, pues yo no me estuviera completando mis tratamientos, mis quimioterapias. Yo no sabría dónde, pues ya a lo mejor estaría ahorita en un shelter, donde, no en mi casa, porque también me ha ayudado para mi renta o mis biles.
If a patient needs assistance, we try to, of course, see if the insurance covers. And at the last resort, we use our funds. We try to stretch money as much as we can.
3 years ago, my oldest grandson was still playing football in high school, and I would get abdominal pain during the football season. Between October and Thanksgiving of that same year, I was getting small pains. By Thanksgiving, I couldn't take the pain no more. So I ended up in the hospital. That's when they found a tumor. And worse, it was on my wife's birthday. That's a heck of a birthday present for my wife. And now I have pancreatic cancer, and it's advanced, but I'm still here. Because I used to be 250 pounds. Now I'm at 120 pounds. When I started losing this massive weight, I couldn't perform my job no more. So therefore, my doctor finally said, that's enough, no more work. I was a military contractor. My job was gracious enough to actually terminate me on the basis of cannot perform my duties. So therefore, I'm collecting unemployment and trying to get things situated so I can continue on. When I was introduced to the infusion center, all the nursing staff, the front office staff are angels. And I mean angels, to the point where my granddaughter has made them a plaque and it's displayed in the infusion center. Thank you to all the angels that take care of my daddy. They have helped me from the mortgage, the utility bills, my medications, and now they're helping me with my CT scans. If it wasn't for this place, I'd have lost everything a long time ago. Maria will help you. The foundation will help you. No matter what. That's the best feeling in the world, considering what you're fighting. Take a good look, not just at what the foundation is doing, for not just for myself, but for other people. And then think about, could it happen to you? What if it happens to me? I mean, what am I going to do? Where am I going to go? Where am I going to seek help? Who can I talk to? The foundation has been a godsend.
Since Sobreviviendo El Cancer was created in 2008, over 5,000 El Pasoans with cancer have received the help they needed at a critical time, thanks to donor support, grants, and events like this. Thank you for your support.
You don't think it's going to make a big difference, but to somebody that doesn't have that $20 to put gas in their car to come and get their treatments, that makes a difference between, making it to treatment that week or not.
So I encourage you, please, give as much as you can and as often as you can. Because the people that actually receive your donation, such as I do, we're grateful